Welcome to Medical Myths, Legends, and Fairy Tales. I'm your host, Dr. Alan Christensen. Look, you know that between the latest online fads and the crazy media headlines, it's easier than ever to get confused about your health. And you and I just want to feel better and live longer. We want to know what works. And we can't wait for further studies. We need to make decisions today based on the best evidence we've got. Well, that's exactly what this show is here for. So let's get to it. Hey, Dr. C here with you. So, vaccines. Do you need to get your shot to stay safe, or is that the most important thing you can do to avoid it, to stay healthy? This has been a topic of huge contention, a lot of confusion, and a lot of fears and misunderstanding. And, well, I often see strong conflicts of opinions and ideas and beliefs. The odd thing is there's really not such thing as conflict of facts. So I wanted to talk with a person who's deeply seated in the holistic world. And I spoke with Dr. Max Cohen. He's a naturopathic physician like I am. Before medical school, he worked as a bench scientist. He was a lab technician, and he was doing work on trying to develop a tuberculosis vaccine. The work didn't end up panning out just yet. Hopefully that could happen at some point. This still does affect many people for lack of effective treatment and resistance in other parts of the world. He works in primary care and also urgent care in Portland, Oregon. And he's been involved with a group called Boost Oregon, which is a nonprofit educational group on vaccinations. So I didn't want someone who's just saying, here's what the CDC says because I'm conventional and that's all I know. I wanted someone who really is biased in natural medicine and the power of lifestyle, and who looks really deep at things like possible dangers, toxicology, someone that has no clear agenda or reason to think any otherwise. So I had a great discussion with Max. I wish that we could see more of him publicly. He's a brilliant man and very, very thoughtful. So yeah, I hope you enjoyed the talk, and I'd love your feedback on this topic. So please enjoy Dr. Max Cohen. Hey, Dr. C here with you, and I'm super jazzed to be joined by Dr. Max Cohen. Hey, Dr. Cohen. Max, how you doing, bud?
I'm good. How are you today?
I'm doing awesome, doing really good. Hey, I wanted to kick off a little bit about just, how you got into this whole world of medicine and your prior work. So tell us a bit about your work with the tuberculosis vaccine.
Sure. So I guess to back up a little bit on that, I did my undergraduate in kind of molecular and cellular biology and graduated and then went to work as a lab technician in a basic science research lab. Their goal was to try and develop an effective tuberculosis vaccine. Now, it's not a big problem in the United States, but throughout the world, there's a huge proportion of the population who is exposed to tuberculosis and will oftentimes suffer from the effects of that infection. And so that was what the project was based on. I was very much low on the totem pole. I was doing the pipetting work, and so, I wasn't designing experiments. I was implementing experiments that were designed by the principal investigators. And so I did that for a little while and realized that I really missed working with people. And while, pipettes are fun and all, it's nice to interact with other human beings, and bench science is really important and I enjoy it, but it wasn't the sustainable career choice for me. So I kind of evaluated my options and ended up in naturopathic medical training because I really love the philosophy. I love the lifestyle medicine approach to how we address chronic illness, especially. And so I started in that training. And when I was in the clinic doing my rotations, I discovered there was a lot of controversy around vaccines that I'd never heard about before. There's always kind of fringe things you see online, but this was a recurring issue in interacting with patients in the clinic, where they were asking me questions that were very mechanistic, very detail-oriented around vaccines, and I didn't have great answers off the top of my head. And so I started digging into the research, and that led me to continue to support vaccines because the body of evidence is really quite robust, but to try and figure out ways to talk to patients about this really quite contentious issue as a medical provider in a way that's non-judgmental and helpful for them, and will hopefully move the needle on their understanding of this topic and allow them to make a decision that isn't based out of misinformation or fear.
So I'm getting an image I hadn't really had before about this. So early on in your training, you were already in the midst of this conflict. you'd had a background in strong science and you were aware more about just the utility of vaccines. And I imagine some of your training and obviously some of your patients' expectations were at odds with that.
Very much so. And I think that there's certainly a selection bias here. Patients who will predominantly want a very natural approach to their healthcare feel that vaccines are not natural. And that's kind of a misunderstanding of how vaccines work, but they have this very strong feeling about them, and that leads to a lot of kind of pushback around the idea that these are necessary and an important personal and public health intervention. And so we, in the coursework, we're talking about the CDC schedule and how to administer them, on track and get everyone up to date. And then in the clinic, I had people coming in with all sorts of very interesting ideas about how we're going to do this, and we're going to spread them out. And can I get just the individual vaccines all one at a time? And so in figuring out how to talk about that, it kind of beget needing to dive deep into the research and see what's going on there. So
I bet you were in some tight spots at many points between.
People look for you to confirm their biases, and a lot of time when you say like, "Oh no, I actually do really think vaccines are a great choice for you and your family," you get some pretty strong reactions to that. But
were there issues that came up between that and your professors? Your doctors you're mentoring under.
I would be hard-pressed to think of a time when I was butting heads with anyone that was supervising me clinically. It was almost always kind of from a patient standpoint of they were wanting to, only do X, Y, or Z vaccines and do them on an altered schedule or wait until a year old or things like that, and needing to counsel them around those things and try and work with them because, at the end of the day, I would rather than get vaccinated on any schedule than no schedule. And
sure.
So it's just trying to find that middle ground and to discuss them in a way that, again, it's kind of non-judgmental, because I think that the common reaction from a lot of providers and a lot of the reason that people come and see NDs is that there are other providers that said like, oh, well, no, if you don't vaccinate, you don't come to my clinic anymore. And I don't necessarily agree with that, but I totally understand the sentiment. So,
one orienting concept, you've done some work about the history of all this. You've gone pretty deep in this story. So just give us some orientation. This controversy, is this new stuff?
Yes and no. I would say that, in general, there have been anti-vaccine sentiment ever since the idea of vaccination occurred. Back when it was variolation, where we were pricking people with a small needle that had an infectious substance on it from a cowpox or from a smallpox lesion. Right, so very, very rudimentary. And, there were political cartoons of that time that showed people growing like cow parts out of their body and saying, like, this is going to be something that happens from vaccine, don't get vaccinated. And I think that we see a lot more virulence in the memes surrounding it now because...
no pun intended.
Yeah, only slightly intended. But that they're so much easier to spread, and because of the way we in general are interacting with them in an online environment, people aren't fact-checking them. And they do seem very compelling at first brush, right? You can see these things that say, oh, well, unvaccinated kids are healthier, and this neat little graph that goes next to it. And, this stuff is hard to parse out when you are trained to look at research. And, I'm not a vaccine expert per se. I haven't spent 10 years just researching and doing scientific studies on vaccines. But, I do have a background in reading the literature and understanding how a study is put together. And even then, it's hard for me to look at some of the stuff and parse it all out. And so as a layperson, to get these bite-sized chunks of information that seem to be legitimate and to not really have the ability to dig in and see how are these statistics done and what was that study like and how are these methodologies valid or not valid, it's really confusing. And I would never fault someone for not doing it. It's hours out of your time, and you have things that you need to be doing that aren't trying to dissect really complicated scientific processes. So.
I heard a George Bernard Shaw quote recently that there's never a problem too complex that won't lend itself to a simple but wrong solution.
I think that's prescient, yes.
So I want to talk a bit about just some things that are practical points for the audience and relevant. Mm-hmm. And one of those, you brought this up. I'd like to go a bit deeper in this topic if we can. It's not one that we had planned on before, but you just talked about spacing the vaccines out.
Mm-hmm.
And I've been talking to people about the fact that I was doing some interviews on this.
Mm-hmm.
And I think that's one of the points that I didn't think of before, but many have thought about as like just the last bastion of a holdout. It's like, why not just give one at a time? Why not just stagger them out? There must be some benefit to not giving so many at once. So what are some thoughts on that point, if you don't mind?
Yeah. So, I would say a couple of things about that. First, it's that, we have this kind of idea that, we're injecting it and then it's suddenly all over the whole body. And that's not really how it works with vaccines. We're putting a really small volume of fluid into a muscle or subcutaneous tissue. And by and large, it is staying right there. So I think everyone who's had a vaccine at some point in their life will probably remember the kind of irritation at the site of injection. That's the immune system interacting with the antigen from the vaccine. That means that it's working, but it's staying right there. That's where the immune system is interacting with it. It's not as though we're, putting the gas pedal down on the immune system for the whole body and we're seeing this huge increase in white blood cell activity in the serum itself. No, this is all happening right there at the site of injection. And so you can give 3 vaccines at a time, and they're all being sequestered in the site that they were injected. After the immune system has had a chance to interact with it at that site, it goes to the local lymph system, and then eventually it will spread the protective memory throughout the body against this antigen set, as opposed to the idea that, we're injecting it and then suddenly it's instantly in the bloodstream and it's just going everywhere. And so I think that's some misinformation around how we think about them. And it's an injection. People think about blood draws, people think about IVs, and, the medical layperson may not understand the difference between all of those things. So in terms of giving more than one vaccine at a time, I don't see a problem with that in the context of they're staying right where we put them. And then the protection from that vaccine is slowly going to develop over a couple of weeks.
So in terms of efficacy or overall protection, are there any drawbacks or are there any advantages to spacing them out, some of these alternative schedules that are talked about?
So I guess the other thing that is probably worth mentioning is that people think of the CDC schedule as just kind of this slapdash, like, we'll put them all together and drop them on a list, and then we'll just give them at these intervals for, no reason or some really weak reasons. And at the end of the day, it's actually a very highly studied scientific document, and there are good rationale for why it's done. Some of it is public health, because we're capturing these vaccinations or administering them at intervals where you're going to the doctor. And the other is that we need to prime the immune system to be able to handle this stuff for when the maternal antibodies start to wear off. So, at 6 months, we start to see a waning of the maternal antibodies that were in an infant's blood. And we want them to have already started making antibodies against these vaccine-preventable diseases at that time. So if we delay administering that till after 6 months or after a year, there's going to be a window during which the maternal antibodies have really bottomed out, so they're not protected at all. And because it can take more than one dose of these vaccines for there to be full protection against the preventable diseases, they don't have any antibodies against the diseases that they have made themselves. And so you increase the window during which they would be susceptible to an infection. We also know that if you delay, you can oftentimes get more severe vaccine reactions, right? As your immune system becomes more competent as we get older and older. The same reason it's really bad to get chickenpox when you're 20 compared to when you're 7. Right? Your immune system has a much more aggressive response to that, and we know that will actually probably increase some of the negative side effects of vaccines if you are delaying and giving them later and later and later. You also then age out of some of the vaccines, like the rotavirus vaccine. We're not going to give that past a certain point.
So basically, if you're delaying, you're just missing the chance of protection, or you're delaying until it's no longer needed, in which case, same thing, you were left unprotected for a period of time.
Yeah. The other thing that I always talk about when people want to do a delayed schedule, and again, if that's the way we're going to get you vaccinated and you're comfortable with it, I would much rather have you getting on a delayed schedule than on no schedule at all. But there's the stress of the actual visits, right? If you're going to break up what could have been one visit into 4 different individual vaccine visits, you're getting in the car, you're driving in traffic, which is a risk of its own, right? You can get into a car accident on your way to or from the clinic. And if you're going to do that, you're going to do 6 more drives to and from the clinic than if you just came once. That's a non-trivial risk in my mind. And then we also have the stress to you or your kid, right? You're getting really wound up. Most kids don't like shots. I totally get that. I'm not a fan of receiving them when it's my turn either. But, once a kid is getting their first vaccine, if we add 2 more onto that visit, are they going to be that much more upset? Are they going to be that much more stressed? Most of the time, they are already crying, already feeling pretty hard feelings about what's going on. And if we add 2 more vaccines in that visit, then it's over. It's done with. It was 1 visit. It was 3 pokes. And you're not then going to be coming back 3 more times to really cement the notion that every time you go to the doctor, a single painful event happens.
Funny thing, I've heard about the remembering self. We have the experiencing self and the remembering self, and a lot of the remembering self base things upon the peak of the experience and then the end of the experience. And so, yeah, exactly. That's what we're seeing in psychology, is that if you did 1 visit that had a few things that weren't fun versus a whole bunch of visits that weren't fun, there would be more to anchor in the remembering self with a larger number of visits.
Right.
So, and you mentioned about the dangers of driving to or from the visit, and I think that'll become quite logical. It makes some sense when we get into context about what some of these risk levels that we're talking about. So, yeah, most adults, one of the decisions they're often making on a regular basis is influenza. Those that are no longer managing school-age kids or making decisions that way. Their big question is, should I get a flu shot this year? So let's start out with just some of the risks that way. Like, what are some of the drawbacks of getting the flu shot?
So, statistically, the risks are going to kind of fall into 3 buckets. You're going to have the common, you're going to have the uncommon, you're going to have the exceedingly rare. And, when it comes to the most common reactions, the most common negative side effects of the flu shot are going to be that soreness and maybe a little bit of redness at the injection site. 15 to 20% of people will have kind of a larger local reaction there. And for anyone who's ever had a vaccine, this is something you've experienced in all likelihood. It's usually not terribly severe. The flu vaccine year to year doesn't usually cause a ton of pain at the injection site, but certainly people can experience that. And so again, 15 to 20% are going to have that occur. Much less common is a more systemic reaction. That can be fever, some fatigue, muscle aches. Now, it's important to know this is not the flu, right? You can't get the flu from a flu shot. But this is just your immune system reacting to the vaccine, and about 1% of people will experience that, so 1 in 100.
So just to go a little deeper on that, I think many have had a sense of they themselves or loved ones of theirs who have had a flu shot and quickly had something occur soon afterward that sure seemed like a flu. So what would you say about that?
I would say that humans are really, really, really bad at correlation and causation. And so when do we give the flu shot? We give the flu shot as we go into the winter months, right? And what happens in the winter months? People start to get colds. Now, colloquially, we call everything the flu, right? I had a 24-hour flu. I had the stomach flu. I had, a flu. And that is different than influenza. And again, colloquially, we don't necessarily differentiate those things. However, clinically, there is quite a big difference. That being said, because we give the flu vaccine on a population level, statistically, it is a guarantee some people are going to come down with a cold or even come down with the flu because the protection takes about 2 weeks to be effective after they got the flu vaccine. But that doesn't mean the flu vaccine caused it. It simply means that it was something that happened around the same time.
So in terms of the probabilities of some of these more significant side effects, what are the numbers that we have around that?
So I think the most severe side effect that has been well documented is that of the Guillain-Barré syndrome, or GBS. And that is an autoimmune condition where the body attacks its own nerves, and it can lead to some pretty severe illness. That happens on the order of 1 in a million. And that's the level at which we would see almost at the same level as in the background population. We don't know what causes GBS in every case. It can be from any infection. You can have a virus that isn't the flu that can trigger it. It could be some sort of other environmental exposure. About half the time we have no idea what caused it. People just come down with it, and we never figure out what may have been the triggering event. The other thing that's important to note here is that the flu itself as a virus is very good at causing this compared to the vaccine. It's a 1 in a million chance with the vaccine. Your chance of getting the GBS condition after getting the flu is 18 times higher than baseline. Right? So it's much, much more likely to happen after getting the flu itself than after getting the influenza vaccine. But it has been documented that it can occur with the flu vaccine. I think one thing that's good to remember here is that it seems like it's more common with the H1N1 strain of flu, and it's the pandemic flu strain. We saw this side effect coming up a little more frequently in like 1976. The flu vaccine for that year had H1N1 in it, as well as 2009 also had it in there. And we were seeing a slight uptick in GBS after those vaccines. Again, still in the 1 to 2 per million likelihood, so it's not a common occurrence by any means. But H1N1 is very good at activating the immune system, and again, we know that H1N1 causes GBS at much, much higher rates if you contract it.
Okay, so GBS is one of the more significant reactions. Mm-hmm. It happens to a lot of people from after any infection or for no clear reason. And the rates of it from vaccination are pretty similar to the rates that are happening just randomly. A few flus have caused much more of it, so not so much a real reason to reconsider the flu shot. There's no real change in that risk from what I'm hearing.
I mean, I would buy a lottery ticket the same day if you're worried about it. The risk of being struck by lightning is 1 in 700,000. Right?
So it's higher.
It's much more likely for you to be struck by lightning than to get GBS after the flu vaccine. Again, statistically, because we give this flu vaccine out on a population level, someone may come down with GBS after the flu vaccine. It's not always possible to know if that is from the vaccine itself or from something else that triggered it for them. And it's about the background rate here is 1 to 2 cases per 100,000 people in a population per year. Right. Mm-hmm. So it's this incredibly uncommon thing. And when we have incredibly uncommon things, it's very hard to discern correlation and causation because they're occurring so infrequently that we don't have the numbers to really delve into that statistically.
Okay, so besides GBS, what are some other significant complications we should think about?
I'm not aware of anything more serious than that. Again, there's the local reactions that can be uncomfortable, and then the kind of systemic reaction of the fever, fatigue, and muscle aches. It's really kind of a low drama vaccine in my mind in terms of the things that it can cause as negative side effects.
So I hear people often talk about the vaccine injury group. I'm gapping on the proper acronym, but there's reported injuries and complications and lawsuits about that. And you put together some data on just the prevalence of those reports and then also just the process of forming those. My understanding is that there's really not complete vetting to separate out correlation from causation in those cases. You want to expand upon all that? Or?
Sure. So it sounds like you were referencing the VAERS system, the Vaccine Adverse Reporting System. And so there's 2 kind of surveillance systems that exist for vaccines in the United States. And we have VAERS, which is a reporting network that anyone can report to. And there are absolutely there's no vetting on these reports, right? Anyone can report to it because it's designed to collect as much information as possible. And so you will see all sorts of very interesting reports there. So like car accidents that happened a few days after a vaccine.
You're kidding. That goes in?
Yep, that goes in.
Okay.
And because again, there's no vetting of these. It's just a data collection point.
Okay.
Yep. And then what they're looking at is, are we starting to see any collections that are triangulating towards vaccine being administered? And so again, it's a pretty wide open system. And again, anyone can report to it. It's not just clinicians. So I've seen some anti-vaccine memes out there saying that, the doctor refused to report this to VAERS. Well, you can report it to VAERS if you're worried about it. It's just not accurate that you can't do that. Like, you are not beholden on you can report this without your provider's permission or consent or anything like that. It's just a data collection system. And they put it all together and they start to look for patterns. And then there's the Vaccine Safety Data Link, which is a case matched cohort. It's much more of a fine instrument for discerning these things. And that is slower to react because, again, they have these case matched controls. But it's relatively large. I don't have the numbers in front of me to speak about them with authority specifically, but it's a little bit slower to respond, whereas VAERS is very quickly collating data. And if they get any red flags coming out of that data, they then very immediately start rapidly trying to figure out what's going on. And then pausing vaccination or pulling things off the market, things like that are all results of those monitoring systems.
Well, so then back to influenza. So we talked about some of the risks of the vaccination, nothing too relevant as far as what we have from data. So if someone's concerned, what are the drawbacks of them just opting out and not vaccinating in general for influenza?
So the risks of not vaccinating against influenza are, most obviously, you could get the flu. Right? The hard thing, especially with the flu vaccine in general, is that it's not as effective as we would like. And flu is very good at disguising itself, and for lack of a better analogy, it kind of changes its clothes every year. And so the all points bulletin we put out the year before to try and find that version of the flu may be different year to year. The efficacy can be up and down, but in a good year, we're looking at 60-70%. In a bad year, it can be 15-30%. On average, it's in the 50 to 60% range. So, aside from the risk of getting the flu, what are the other risks here?
Complications from influenza.
Yeah, complications from, and that tends to be what the issue is. And what we know is that the flu vaccine, while it's not necessarily the best at preventing influenza infection by itself, although a 60 to 70% chance on a good year is infinity times better than 0%, right? Any percentage of efficacy is better than being totally unprotected. And what we've seen is that it seems like the flu vaccine is actually quite good at preventing complications from the flu. So you could still get the flu after a vaccine, but are you going to have as severe an illness? And the answer seems to be a pretty resounding no. So in terms of the data that we have here, the studies that I pulled up relating to this, I can just kind of go through them really quickly. So it seems to prevent severe disease in elderly individuals. So this was a case control study in 20 hospitals. They found that repeated influenza vaccination, so they looked at over the last 3 years, did people get 1, 2, or 3 vaccines, or none? The repeated vaccination seemed to reduce the chance of really severe illness. Compared to the unvaccinated individuals, vaccination was about 74% effective at preventing ICU admission, and about 70% effective for preventing death from flu complications. All right, so it's for people who got the vaccine, they still got the flu, but it was 70% effective at preventing these really severe issues, which I think is something that isn't talked about enough, right?
So just working or not, whether it works or not, I just think doesn't give the full story.
Correct. Similarly, we've seen that it seems to reduce hospitalization in general, especially in older adults who we know are going to be more susceptible to severe illness. In a study of 450 older adults, this research found that the flu vaccine was about 61% effective at preventing hospitalizations for the flu, compared to, again, the unvaccinated individuals. And then just in regular adults, and not even older adults, if we're just looking at a cohort of adults in general, that's 71% effective at preventing hospitalization. And this is another study that was case controlled in 4 separate hospitals. And what I liked about this research is they looked at the vaccine records and they said you were unvaccinated unless they could confirm for sure that you had received that vaccine through medical documentation. So if you were enrolled in the study, you got the vaccine, but it wasn't documented for some reason, and you told the researchers, well, I got the vaccine, I just don't have documentation of it, they put you in the category of people who were unvaccinated because they couldn't confirm that had happened. So
got it. So that would have made the results less dramatic.
Right. So it's entirely possible that the efficacy was a little higher than what they measured here because they were putting people who could have been vaccinated into the unvaccinated group because they couldn't confirm it. So really stringent methodology, which is always great to see in this kind of research. I think the other group that is pretty susceptible to negative flu effects is going to be kids. And this is another area where it seems like the flu vaccine is really helpful at preventing issues with severe infection. So in the unfortunate event when a pediatric patient dies from influenza, about 80% of the time they're unvaccinated.
Wow.
Which is a pretty stark number to think about, right? 80% of the time.
And this is large numbers of deaths per year, if I remember correctly.
Tens of thousands, if I remember correctly. I don't think that's just pediatric deaths. I think that's all every year. But yeah, it's a non-trivial risk. And then in another study that was done by pediatrics, they saw that about 26% of kids who had mortality due to flu complications were vaccinated. So again, that tracks well with the 80%. So the 20% or 26%. So the majority of cases in this study, 74% where there was an unfortunate death due to flu complications. The kids weren't vaccinated. So the other thing that is good to note here is about asthma, because flu is a respiratory virus and it can really create asthma exacerbations in susceptible individuals, and those can land you in the hospital. In this research, they found that the flu vaccine was between 60 and 78% effective at preventing asthma exacerbations that led to emergency department or hospitalization.
And like you said, 16, 70 is not perfect, but it's a whole lot better than none. So that certainly makes sense. So I asked my audience about this too, and about their concerns, and that's where many of these came from. And some were highly more common than others, much more commonly asked than others. And a big thing that came up was about MTHFR variations. If those that have variations in how they methylate, they might genetically, that if this makes them more at risk for some of the complications from vaccines. There's quite a few concerns about that going around, and many who are in the health space are aware of their MTHFR status. So yeah, any input on this one?
Yeah, I would say that I see this quite a bit, and it's a question that we do see a lot, especially in the environment I practice in. A lot of people do know their status with related to these genetic polymorphisms, but the simple answer here is no. There's really no evidence that supports that idea that these polymorphisms are going to increase the risk of a negative response to a vaccine. And genetics are kind of beyond, the genetics of these polymorphisms are beyond the scope of what we're talking about right now. But the kind of 10,000 foot view here is, the amount of a thing that you need to detox in a vaccine is really quite small. And I know we're going to talk more about that later, but in general, we are exposed to larger amounts of things that we need to detox regularly on a day-to-day basis. So if these enzyme polymorphisms made it so that you could not detoxify common things that your body needs to process, we would not have made it very far as a species. 40% of people have one of the polymorphisms. That if these were somehow dangerous or made it so you couldn't detoxify normally encountered things, then we wouldn't have made it very far at all, let alone to the point where we're dealing with the really minimal amount of preservative or an aluminum salt in a vaccine. I have seen a lot of kind of hypothetical mechanisms to explain why you might be at higher risk, and it's usually depleting glutathione and things like that. And we can come up with mechanistic arguments for a lot of things that might have bioplausibility, but at the end of the day, we have to see are negative reactions to vaccines happening in 40% of the population, right? Because that's the number of people who have at least one of these. And the answer there is just no, right? So we're talking about what we see on a population level does not match with the mechanistic hypothesis of, you don't have as much glutathione, so you'll have a harder time detoxifying the components of the vaccine. And I don't think it comes out in the wash.
Bioplausibility. I love that term. There's Rudyard Kipling wrote the Just So stories. And one of my favorites was How the Elephant Got Its Trunk. And it was a story about the baby elephant. Well, back in this time, the elephants all had these mere boots, like structures for trunks. They didn't have the long, sinuous trunks. And the story was the elephant was down on the river's edge, and he wanted to know what the crocodile had for lunch. And the crocodile said, come hither, little one, and I'll tell you. And of course, the crocodile wanted to grab him and eat him, but he got a hold of the little stubby nose and pulled and pulled and pulled, and they fought. And so the short answer is, to this day, that's how the elephant got its trunk. It got all stretched out by the crocodile fight. And there's bioplausibility in that story. You can make a case for that. Yeah. But the bizarre thing is that, not only do many things that are bioplausible not pan out, but so often it'll even just be the opposite. Things that seem to be intuitive about how things work in biology, because of all the checks and balances and homeostasis, often things are the exact opposite of what you would intuit. And, just one more quick rant about genetics and polymorphisms. There was a paper I just made some comments on in which they showed that the direct-to-consumer tests, when they were compared against clinical gene assays, 40% of the time, they were eliciting false results on a few genes that were looked at. And this one wasn't comparing the whole analysis, but looked at a few select genes. But there's no reason not to think that other genes that weren't compared in this way are more accurate. And then there's a big gulf between your gene status and your gene expression. So I highly discourage people from getting too stressed out or concerned about what they see in their 23andMe results.
Agreed.
So another big one that's come up still is about autism. So MMR
Mhm.
vaccine and causing autism. So what do we know so far about that from good data?
Uh, well, so this is an area that has received a ton of really high quality research, and the answer, which has not changed at any point over time, is that no, the MMR vaccine does not cause autism, and it doesn't even seem to be capable of triggering such a thing in high risk groups. And we'll talk about some of the data there in a moment, but. We don't know for sure what causes autism, and that's why this is such a challenging area to talk about, because we don't know what causes it. So we are out here trying to figure out what's going on. But with the amount of research that's been done at this point, I think that we can very conclusively say MMR does not cause autism.
I should throw something in real quick. When the Andrew Wakefield study came out and some of those ideas were circulating and plausible, our daughter was just born. This was back in '98, and I myself was concerned and hesitant. I was not really aware how this would play out, and so we did wait. We didn't see as many preservative-free options. We did end up spacing hers out and opting for preservative-free. But yeah, I think the data was less clear then than it is at this point.
Right, and I mean it makes total sense to have an abundance of caution when that kind of headline, I suppose, is as out there, and I think that's where the confusion comes in. Right, is that there's this kind of longstanding cultural myth around it, like, oh, MMR and autism, and even if it's not true, and even if people are hearing over and over again it's not accurate, there's kind of an availability heuristic there, where it's like, well, when I hear autism, I think MMR, even if the word does not, or the words do not cause, are between them. There's this kind of cultural correlation there that people tend to think of. That again, fortunately, we have some really incredibly well done research that has put this to bed over and over and over again. And I don't think it's going to stop people from talking about MMR and autism, but I think that we have pretty conclusive evidence at this point that it's not the case. I think my favorite study relating to this issue is called Autism Occurrence by MMR Vaccine Status Among U.S. Children with Older Siblings with and Without Autism. What they did in this study is they looked at just shy of 100,000 children, and they were looking specifically at high-risk kids. Right? They were looking to see, do kids who get the MMR, who have older siblings who have an autism spectrum disorder, develop autism at a higher rate after they get the MMR?
Wow.
And right, so this is a very, very
it's going to show up here.
You would expect it to, because they already have a significantly higher risk of autism. Period. Right? We know there's a genetic component here. Right? There's something to do with how the neurons are migrating during embryogenesis and brain development, and so there's a genetic component to this. And they found in this study that there was absolutely no relationship whatsoever between vaccination and autism spectrum incidence at all. Regardless of whether the children they were studying were at a higher risk of these conditions due to inheritance.
And I've heard of a study too in Japan, I believe, to where they had stopped vaccinating for a period of time in response to an increased MMR trend. And correct me if I'm wrong, but the trend of they stopped MMR vaccines because of concerns about elevating rates of autism. And to my memory, the rates of autism kept on going up with no change despite the withdrawal of MMR.
That's absolutely correct, and that's the last bullet point I have on my research list here. And I think this is another large study, 300,000 people in an area in Japan that completely stopped using the MMR vaccine, and MMR use trended down, and autism spectrum diagnoses trended up. There was absolutely no pause. It just kept on trucking, and we don't know what's causing that. Right? That there's cause for concern. I understand being concerned by seeing an increase in diagnosis rates, but again, we're seeing that MMR does not seem to be related at all. So another study I think is really important here looked at the entire population of Denmark. Right? They looked at 650,000 children, and they followed them for 13 years. Right? This huge study population, and they followed them for a really long time. And the same finding was here, that there was absolutely no relationship between vaccination status, MMR administration, and autism spectrum disorders, even in those high-risk kids. Again, those who have risk factors for the condition, such as a sibling with autism.
So yeah, just no strong relevance that way. And that's a tough thing. Ideas emerge and they form and they keep on living past their utility. I actually had a talk with a friend just last weekend about this exact topic, and she's a pediatrician who's more vaccine hesitant, and she argued that with so much strong conflict on both sides, that the truth must be somewhere in the middle. And I thought about
Mm,
that. That comes up a lot. People have an expression that if there is conflict, we must think about both sides having equal merits and equal weight. And there certainly are
mhm.
many times in which people can be well informed and there can be good points on both sides of an argument. But I would argue that that's not always true. We're seeing like the flat Earth groups gaining momentum faster than they ever have in the past. And I would argue that the truth is not somewhere in the middle in that case. The Earth is not half flat.
Right. Well, and I think it's the Overton window, right? It's the idea of the range of ideas that we talk about, right, in any given conversation, right, and then it can be pulled to one direction or the other. And when we talk about vaccine injury over and over and over again, that it does kind of pull that range of discourse over to the side where we're talking about that with the same gravity of the benefits of vaccines. And we know that the data shows us that by and large vaccines are phenomenally safe, more so than almost any other medical intervention that we have access to, certainly on a population scale. And then we're kind of giving equal time to the idea of like, well, do vaccines really cause all these bad things?
Yeah.
And when the data tells us they don't, which is not to say that no one has ever had a bad reaction to a vaccine. I don't know any vaccine advocate who would argue that no one has ever had a negative response to a vaccine.
Well,
Right?
and I've read histories of this too, and for sure it's happened, but by and large, it's been dealt with quite transparently. And for
Mm-hmm.
example, intussusception with the rotavirus in the rather recent
Absolutely.
past. So
Right.
these things have shown up and they have been identified, and in many cases they've been identified by industry, and they've pulled vaccines, they've changed vaccines. So yeah, it's not that no one's been looking.
Well, and I think that, I often hear that, the pharmaceutical companies are making tons of money based on these products. And certainly there is some profit motive here. It's not very much compared to what they make off of people being sick, right? But look into was it 2 years ago now that they took one of the HPV vaccines off the schedule? They said if you got 2 of these before you were 14, you don't need a third. So 33% reduction in
Income.
them getting to sell that vaccine.
Yeah.
If people are getting it early enough in the timeline, that doesn't match with the idea that this is some nefarious scheme that has somehow roped in every researcher in the world to try and cover it up and make as much money as possible off of preventing cervical cancer, right?
One point that comes up too as a concern that's made me think of this is, we give so many now. We give so many more than we gave a few decades ago. And that also seems to be just rubbing against people's common intuitions.
Yeah. And I think, certainly we vaccinate for 14 vaccine preventable diseases now. And in the past, we were not able to prevent as many diseases. Again, it's kind of the memes that I see about this is, in the 1950s, they only got 6 doses, or I don't have it in front of me, but
yeah,
and now we're getting 70 doses, and it's not even stretching the truth. It's just a lie. All right. Back then, there were 6 vaccines, but they were given every 3 years. Right. We were giving them really frequently. And
wow. All of them were given every 3 years, or the group of them was?
Similar to that. I'm sorry, I don't have the information in front of me to tell you perfectly, but yeah, they were being given on much more frequent intervals because we didn't know how well they were working.
Sure.
And the science was still developing. And so they were actually getting something like 26, 28 vaccines over the same time frame. But then that same kind of anti-vaccine meme breaks out the number of vaccines you get. There's like 76 doses of vaccines, and maybe more, maybe less, depending on if you're getting combination vaccines. But it's really disingenuous, right? The idea that they just got 3 shots ever and they were done. Like that's just not what was happening back then.
And then the big one that came up a lot too, which I've been hearing more about, is then autoimmunity. That's a big part of my population's concerns with autoimmune thyroid disease and autoimmunity in general. So, and I can see where that could be a bioplausible thing. If you're doing some change in the immune system, getting it to attack something, what if you're getting it to attack the body itself? So what do we got for data about autoimmune risks or concerns for those that have autoimmunity?
Yeah. So Yeah, I also hear this question quite a bit, and I think that some of it stems from a misunderstanding of what vaccines are in general, and what I would say to that is that what we're doing is we're taking an organism that can cause disease, we are killing it, we are extracting specific proteins from it, and then we are exposing the immune system to these proteins so it can get practice dealing with a inactive form of this disease. They're not made in a lab out of, there's no lab coated person making Frankenstein proteins out of like different things, or, making up brand new, never before seen compounds and just injecting them. And these are all naturally occurring viruses or bacteria, and we're just taking little pieces of them and exposing that to the immune system so it can get some practice dealing with it. So it's really unbelievable that we would see a autoimmune condition arise from a vaccine that is different than the autoimmune condition that you would get from, or potentially get from, having that infection in the first place, right? Because we're not inventing new antigens. We are taking antigens that already exist, those little pieces of a bacteria or a virus, and we are exposing the body to them. So certainly infections can trigger any number of autoimmune conditions. It's relatively uncommon, but you can have, in the example of GBS, like we discussed before, that can be for any reason, for no reason, because you caught the cold or because you caught the flu. We don't know why it's going to be triggered. So, again, what kind of data do we have here? So one of the areas that I've heard this talked about most frequently is with the HPV vaccine, actually. And so there was a study done of about 1 million women who received that vaccine, and they were monitored for 180 days after the vaccine to see if there was any pattern of any autoimmunity popping up here. And so they were looking at specifically 23 autoimmune diseases, and they saw absolutely no correlation whatsoever with 20 of these. And then there were 3 that they saw very weak correlations with. So that's Becquet's disease, it's a pretty rare type of blood vessel inflammation, type 1 diabetes, and then Raynaud's phenomenon, the spasm of the blood vessels in the fingers, usually as a response to cold. So what the researchers noted here is that the relationships were not strongly supported because they occurred totally randomly in the 180-day time period. There was no tracking with the administration of the vaccine. And, when you're looking at 23 different variables, statistically, you're probably going to get a hit on 1 or 2 of those, just randomly. And because they saw no defined pattern in the data they were pulling on those, they said, they reported it accurately. They said, we saw this very small, statistically significant correlation here, but we don't believe it to be clinically significant because it was happening at totally random after that. And because these conditions do occur independent of vaccination or infection or anything else, we don't always know the trigger. It's going to happen to some people after they get a vaccine, just like some people are going to get a cold after they got the flu shot. Doesn't mean the flu shot caused the cold. Some people will be diagnosed with type 1 diabetes after having received a vaccine or any number of vaccines, or having had an infection, or some other trigger we don't know about. And so there was no strong link here to hang our hat on.
And did they do a comparison against a similar cohort study for the similar time frame, or?
So I think that's how it was put together, as they were looking at baseline.
Oh, got it.
I would have to pull up the methodology, which I don't have right in front of me here.
An analogy that I've used, it's a tricky thing, but in the case of autoimmune thyroid disease for Hashimoto's, somewhere around a quarter, I've seen stats saying 27%, but somewhere around a quarter of people probably do have the disease go into just full remission over the course of several years. And I've called this the blue socks treatment. If someone in that group happened to be wearing blue socks, they could say, "Oh wow, I wore blue socks and now my Hashimoto's has gone away. It's been cured."
Right.
And doesn't mean that it caused that, but that's a difficulty on the opposite side too, where someone can think that doing something that wasn't helpful caused a beneficial outcome. But yeah, we see this in big groups to where a certain number of people will have good outcomes and bad outcomes, and we have to, and we can only really make correlation when we're looking at larger groups and large data sets to help to analyze that. So yeah, it gets tricky.
Well, and I think it's the same sort of thing that makes treatments that we're doing reactively seem a lot better than treatments that we're doing preventatively.
For sure.
Right? So if you come into, when you go to the doctor, when you're feeling sick, and I could probably tell you to do anything, and you will start to feel better because the natural course of whatever's going on is that it's probably going to get better.
Yeah.
And so, no matter what treatment you get, you will likely start to feel better. And that makes all those treatments look great. And then the inverse is true with, say, the flu vaccine, right? You got the flu vaccine right as you start going into wintertime. You got a cold.
You were feeling fine at the time. Yeah.
Right. Or you got the flu. And even though you didn't have as severe an illness as you would have if you hadn't gotten the vaccine, you are correlating in your mind, I got the flu vaccine and then I got the flu. Like that sucks. And I get that, right? We are pattern recognition engines. And that's why we're so bad at statistics, is because we really want to assign causality to situations that are simply happenstance.
And what you're talking about now has been called the regression to the mean. Things are more apt to go back to normal when they're away from that. I've heard this talked about in athletics as the curse of the Wheaties box. So it was observed amongst athletes that when someone's picture would be on Wheaties, that inevitably their career would go down. And that was thought about. And if you think this through, when someone gets on the Wheaties box, they've done something pretty stellar. They've had some hugely outlying level of performance. And they probably weren't bad athletes. They were probably good athletes, but nonetheless, from where they were as their baseline, that was probably something that was statistically improbable and just a real big outlier. So in response, the most likely course of events after something that occurs that's way outside of what your norm is, you're much more likely to be at your norm or maybe even below it in the short-term future. So yeah, after they're on the Wheaties box, they probably are going to do worse, but that's not because of the Wheaties.
Exactly.
So here's, I think, the last big point I wanted to go deep into is, okay, so maybe that the little pieces of infection aren't all that bad. Maybe they're less harmful than the actual infection itself. But what about all the dang stuff that go in the vaccines? We had thimerosal back when, and now we've got these aluminum things. We've got formaldehyde. That can't be good, especially if you're getting a lot of shots all together. So we talk a lot about wanting to minimize our exposure to environmental toxicants, how bad they are for us. And here we are injecting them straight into the bloodstream. So what's up with these preservatives?
Well, I'd put a pin in that for just a second and remind listeners that, we're never injecting a vaccine IV, right? So it's not going directly into our blood. Some of it is, of course, absorbed, but I think that that's a common misconception that I hear. It's like, we're going to put it right into a vein, and generally they're being placed into a muscle. That being said, on the topic of formaldehyde, I hear this one a lot, and I think this one, everyone knows formaldehyde, right? They dissected the frog in high school.
It smells awful.
The smell. It smells terrible. And, it's a preservative. It absolutely is. And it's used in vaccines so that they stay sterile and are safe to administer. The amount of formaldehyde in a vaccine is minuscule. And I think the important thing to understand about it is that we are making formaldehyde in our bodies all the time. It's an essential byproduct of synthesizing proteins. So right now in your body, you're just making proteins all the time, and you are creating formaldehyde as a metabolic byproduct. So for your adult listeners, they have probably 2 to 3 milligrams in their in their circulation right now. And an infant has about 1.1 milligrams of formaldehyde in their blood at any given time. And that's 10 times more than they would ever receive from a vaccine, right? It's also, because it's a totally normal metabolic byproduct, something that we detoxify very easily, right? It's just broken down into constituent parts and excreted. It's not a problem. It doesn't back up. It's not going to bioaccumulate, but it's something that we're exposed to constantly. And this is another one of the examples of dose making the poison, right? If you stick your arm in a vat of formaldehyde, you're going to have a bad time. But if you receive an injection that has a minuscule amount as a way to keep the injection sterile before being administered, your body just immediately churns through that formaldehyde at the site of injection, and it's gone. It's not something that I would encourage people to worry about. But I understand, because everyone has that memory of, the frog in high school. I remember that they told me not to touch it without gloves and things like that.
So this particular one is not foreign to the body, and for sure there are a large number of chemicals that, are things our bodies never did make and really don't have mechanisms to deal with. And in those cases, their toxicology ranges can be quite different. But this is one to
For
where
sure.
the amounts and the substance we're talking about, it's stuff that we already have inside of us.
Yep, absolutely.
And other big one that's relevant now is aluminum, right?
Mm-hmm. Yeah. So, I mean, it used to be thimerosal, which was kind of the bugaboo back in the 90s and early 2000s. It's kind of a non-issue now because it was removed from all childhood vaccinations in 2001. So the only routine vaccine that still contains any thimerosal at all is the multi-dose flu vaccine vials. That's where you have 10 doses of the vaccine in one vial. And because you access that vial multiple times, it's used as a preservative to protect it from contamination. It was studied pretty extensively. It was pulled out, not because there was any reason that seemed to, or not because there was any thought that it was causing autism or other negative outcomes, but simply it wasn't a fight that the FDA wanted to have anymore. And so it was just removed, and then we saw no change in things like autism spectrum diagnoses and things like that.
Well, and there's another level to that one too. So it's not really relevant anymore, except for the case of the multi-dose flu, like you said. But there's a big distinction between different types of mercury and the ethyl mercury used in that. It's hard to wrap your head around sometimes, but things can be completely different in how they respond chemically based upon what type of a compound they are, based on what they're paired with.
Yep. And I mean, that's the methyl mercury, which is in tuna, is the one that bioaccumulates really easily and can be damaging over time. Ethyl mercury, which is the constituent that is in thimerosal, it has a much shorter half-life in our body. It's excreted by the kidneys. Again, so it's a non-issue of non-issue, right? And it's not really something you're being exposed to with any regularity.
So now the last thing is the aluminum still that we've got in this, correct?
Yes. Absolutely. So, yeah, here's another area that I think there's a lot of misunderstanding and a lot of confusion around it. And so people say aluminum and they kind of think of their cookware, right? Or they think of a block of aluminum. And really what we're talking about here are aluminum salts. So in this case, it's usually aluminum hydroxide, although there are some others. And they're used in really, really tiny amounts in a vaccine as an immune stimulant. They're there to help activate the immune system. You can think of it sort of like a volume knob on the immune reaction, and it turns it up a little bit so your body is going to create a protective immunity from whatever antigen is near the aluminum salt. And it's gentle, it's well tolerated. It's been used for 70, 80 years as a vaccine adjuvant to help bolster the immune response. And the thing to remember is that aluminum is this ubiquitous part of our environment. It's the third most common element in the Earth's crust. We're exposed to it all the time, whether it's from an antiperspirant or breathing in industrial air or water or food. Breast milk contains aluminum. Babies are born with aluminum in their systems because it's just everywhere. We're always interfacing with this. And for most adults, you're probably eating twice the amount of aluminum every day than is in all of the scheduled childhood vaccines until age 2. And that's a daily exposure. If you are breathing industrial air, so say you're working in an environment with aluminum particles in the air, you could be exposed to over 25 times more aluminum in a day than is in any individual vaccine. So the point of all this is that we've gotten really good at detoxifying this from an evolutionary standpoint, right? If we couldn't deal with aluminum in any way, shape, or form, which again is the third most common element that we're encountering in the Earth's crust, we would not have made it very far as a species.
And this can be a non-intuitive concept too, that things certainly can be harmful at some level, but there's a threshold at which they're not. And I don't see this acknowledged well enough. I think that in the natural side, we do a good job blowing the whistle on concerns about just egregious exposure, but there comes a point at where we have to say that some things are relevant and some things are not.
Absolutely. And again, I think it's important to understand what's going on when we are using it as this adjuvant in the vaccine. So there is a small amount of aluminum here. Again, this is measured, the most you're going to see is around 800 micrograms. So that's 800 millionths of a gram. Right? So it's a very, very small amount. And it's injected into the muscle, and it is absorbed from that site very, very slowly over time. Right? So it's not going right into the blood. It's not suddenly 100% bioavailable. It's injected, and it is persistent in that tissue while the immune reaction is being spurred, and the immunity to whatever the vaccine was for is being developed, and then it's slowly absorbed over time because it's not soluble as a salt. So one interesting study that I think really tells the whole story here is they looked to see if there was a difference in blood or hair levels of aluminum in children after they were vaccinated.
Oh, wow.
And they saw really big differences in the amount of aluminum, period. Like some kids had more, some kids had less. The standard deviation of the amount of aluminum was interesting, but there was absolutely no difference before and after vaccination. There was no correlation to an increased serum amount of aluminum there, and I think that kind of tells the whole story in this way.
So amongst a group of kids, there's a big range in how much aluminum they've got just floating in their bodies, but the vaccinated versus the unvaccinated kids didn't really predict where someone fell in that range. Would that be accurate?
Yeah, and there was no spike in serum values after vaccination. There was no increase in hair values of aluminum after vaccination. It's absorbed from the muscle at such a slow and steady rate, and then just immediately excreted by the kidneys, because that's what they're doing with aluminum all the time. They just didn't see any changes there, which stands to wit, right? It's being absorbed at such a slow rate. It's not going to change the overall concentration in the blood, and it's just going to be continually excreted.
This has been good. It's such a curious time we're in. We've got more data than ever, but the world that we live in, so to speak, the online world in which so much of our interactions occur, it's made on purpose to not ever expose us to things that would startle us or go against our existing beliefs. So it's easier and easier to get stuck into particular ideas or patterns, more so than we ever could in the past.
Oh yeah. I think it's very difficult, and it's hard to sort out the information. As we were talking about earlier, there's just so much of it out there, and how do you parse that out and decide what is credible and what isn't? And when we're making decisions for our own health, when we're making decisions for our children's health, we want to do the right thing. And I think it's a mistake to treat it like buying something off of Amazon where you're reading the reviews, but people want to do that, and that's how we gather information now. Yeah. Right? It used to be if you wanted to read people's opinions on vaccine research, you had to go to the library, check out a medical journal. You had to go to your doctor, you had to talk to someone with this background. And now you can just put in a Google search, and the second thing that comes up is probably an anti-vaccine source, which is frightening from an evidence-based standpoint. But they've been very effective at messaging. Right? Credit where it is due. The memes are viral in a way I wish they weren't.
It's a funny thing. I've talked to my son about this. He's 15, and the memes are cutting both ways. So he was saying how there's so many memes of kids who are 17, 18, and they've gotten vaccinated for the first time, and they're sharing that, and they're sending these photos or pictures, and others are congratulating them on that. So, and now in many cases too, he's told me about a lot of rather harsh and dark comedic memes against anti-vaxxers about, the longevity of things that are, graveyard type humor. But totally. I think that culture is working in both directions.
Absolutely. And there's been a push, I would say, certainly in the last, 6 months to a year, perhaps longer, if I haven't been paying as close attention to it as others may have been, of saying we really need to figure out our messaging on this, right? We're totally losing the battle of messaging against, pretty well-funded anti-vaccine groups. And so yeah, there's definitely been a lot more of the pro-vaccine, side of things, adopting memes or, that kind of gallows humor of, if you want to be a 6-year-old, you should probably get vaccinated. It's been fascinating to watch.
And I hear pushback too of things like, some things we innately find distasteful, like one size fits all approach or government-led programs or things that are made to work for everyone. And there's certain contexts. I thought about this one where, you're in an airplane and you're you're in a commercial airplane, you're flying across the country. Well, those are cases where you want government-led one size fits all approaches, and you don't want everyone in the airplane to have input on how this is being done. You don't want to have, like you said, the user reviews. You don't want to pull the people in 17A and 18A and ask the pilot about the landing procedures. You want the pilot to do his thing, and even if 18A has a different idea, you want the pilot to do his own thing.
Yeah, absolutely. It's hard. It's just such a hard topic, and I think that we need to be good at messaging. We need to be good at discussing these things in a way that is non-judgmental. That's not about like, oh my gosh, you're going to kill your kids if you don't get them vaccinated.
Yeah.
Like, that's not the message that we need to send when we're talking about the safety and efficacy of vaccines. We need to have honest, forthright conversations about the benefits, which far outweigh the risks, both real and hypothetical, that I've heard about vaccines. And I think not making decisions based on fear and being able to make an informed decision based off of real information that has not been fearmongered to push you in one direction or another is the goal. And I think it's the goal of everyone who is pro public health, pro vaccination.
And a few things that are just, almost innate disadvantages, like, home field advantages, so to speak. One of which is the idea about it seems easier not to act than to act. If you're confused, you just would rather do nothing. And it seems like to do something is almost inherently more dangerous than not to do anything.
Absolutely. It's, the inaction versus action and feeling like you made a choice that was wrong or that you are responsible for that. But what I often will discuss with my patients is that making no choice is in fact making a choice. Yeah. And, I've seen with some regularity, whenever there is a pertussis scare in the local community, or even now with the measles, not necessarily right in my community, but adjacent in Washington, there's been a number of cases. People are coming in and wanting to get these vaccines and are feeling very, very worried about it. And so we went from one extreme to the other. They didn't vaccinate because they were afraid of the vaccine, and now they're coming in afraid of the disease, wanting to be vaccinated. And neither of those are ideal scenarios, right? I don't want people coming in because they are wrapped around the axle with fear over one outcome or another. I want to have these conversations in a way that isn't fear-based and is just about making these decisions in a way that is sustainable for you and your family and things like that. As I said before, I'd so much rather have people vaccinated on any schedule than on no schedule, but the CDC schedule is the one that we know is going to provide the most protection at the earliest possible time frame.
So this has been great stuff. We super appreciate your time. And you're most active on Twitter, if I understand correctly?
That's being very generous to the amount I post on Twitter. I certainly am on Twitter. I chime in from time to time, but yes, that is one place to follow that. And then I also a contributing author to ndsforvaccines.com. That's a vaccine education resource kind of tailored for naturopathic physicians as well as their patients to kind of discuss vaccines. And there's a lot of great resources on there, and the other authors there are amazing as well. It's a great resource to share.
So it looks like a Twitter at Maxwell Cohen, COHENND, Maxwell Cohen, ND, and then also ndsforvaccines.com. And these will all be in the show notes too for everyone.
Great.
So yeah, great to hang out here a bit and talk through these things, and really appreciate your time, Dr. Cohen.
Oh, thank you so much for having me. It's been great to have this discussion. I appreciate the chance to be here.
Hey, Dr. C here with you, and this is a follow-up to the vaccination discussion. When I first set out to do these podcasts, my goal was to get people on two different sides of controversial topics, for the ones that were the most heated and most contentious especially. And I don't not have a vaccine hesitant person speaking for lack of trying. I tried really hard to get someone to speak against vaccinations. The derogatory term, I think now anti-vaxxer is defined as derogatory, so vaccine hesitant is the more neutral term. And there are several people leading this charge, many authors, many who are very big on social media. And I'm really fortunate to have a lot of connections with friends in the alternative medicine space. And many of these people I knew directly or I knew indirectly. So through contacts, I asked them to be on this podcast and talk with me. And I had about, I think 7 top experts that we went through the exact same process. And that was, they all agreed. They were all eager to support and help out the cause and eager to be part of a rational, evidence-led discussion on the issues. And as we got closer, they voiced more concern, especially when I talked about, for some, there were more concerns that surfaced when I talked about just talking about the evidence and not really about persuasion or, or detailed arguments, but just the data, just the studies, what the data showed us. But the vast majority were concerned about just their publicity. And in general, they're really shying away from their platform. Many are having their state medical boards persecute them, and really they're under fire for their stances. And that was kind of a funny thing. I had a lot of mixed feelings about that. Many of these people are friends of mine, and I don't want anyone to come of ill, to have bad things happen to them. And also, I am a big fan of freedom of speech. I think it's a cool thing we've got going here in the modern world, and I'd love to support that. So I almost thought, it's too bad that they don't feel safe to speak out, because the more public they are, the more they become targeted for some of the crusades against the anti-vaxxers, the anti-vax crusades. And then I thought that through some more, and we do value freedom of speech, but there actually are some limits to that. And I would agree with the limits we have in place. Classic case in point, you can't run into a theater and shout fire, right? That's always talked about as a counterexample to freedom of speech. That's not free speech. And the reason that it's not protected is because people would get harmed. The concern, especially in the past, when maybe some don't know the history of this thing, but the film, the actual film itself that was used for making movies, it's highly flammable. If anyone saw Inglourious Bastards, that was kind of like a big part of one of the plots. But yeah, old movie film was combustible in the past. And fire safety was not what it is today. They didn't have proper exits, and too many people could be in a room. Fires are more common in general. So historically, to go into a crowded theater and yell fire, well, that was a valid concern. And if there was a fire, you had to get out quickly or you probably wouldn't survive. And that's been a classic example of something that's not protected as free speech, because you could do that just on a whim, just because you wanted to amuse yourself, and people could die from being stampeded. So that was not considered free speech. And in that sense, this brings to mind the almost nuclear power of fear. And we see this in political discussions. We see this in news, that things that are scary grab our attention in ways that nothing else does. And it's almost not fair. If one side has a scary story and one side has just hard, cold facts, it's almost like you've got two wrestlers that are not in the same weight class. It's not a fair fight once fear gets into the equation. And we all understand that. And that's why you can't do things that engender high amounts of fear. So it's easy to dismiss someone who just wishes to yell fear for their own amusement. Wishes to yell fire for their own amusement. We got that. That's not okay. That's not free speech. But what about the person who says, hey, maybe there is a fire? There's not an obvious fire. There's no billowing smoke and there's no giant flames, but I still think there could be a fire. What would we say to that person who wished to yell fire in a theater? And what if they made a really plausible argument? Not all fires have smoke. Not all fires have visible flames. You could have some smoldering embers somewhere that were not visible. Heck, you could have smoldering embers that were inside of a seat cushion, and they could be not visible at all. There could be no smoke whatsoever. But once they caught hold of that seat cushion, they could take off. They could spread fire throughout the theater, and everyone could be in danger. And another thing that comes up is the inability to prove negatives. You can't prove that there's not a smoldering ember in somebody's seat. You've got 200 seats in a theater. You couldn't see inside every little seat. Maybe there's some smoldering embers there. It's not probable, but it's not impossible. So that one seed of doubt is often all that people need to start creating some fear. But even if someone were to say, well, I yelled fire because I think there's a smoldering ember under this seat. It felt kind of warm and someone looked suspicious when they left. I think they planted something here. I think they pushed some smoldering embers down inside the seat cushion. And yeah, I think there's a fire here. Well, that person still would not be protected under freedom of speech, because we know that, sure, it's possible, but the likelihood is so low. We've got to draw a line somewhere. Not all things that are possible are probable, and things that are improbable enough are okay to dismiss at some point. We can't grant that anything improbable can happen, or else we're completely paralyzed by infinite improbable possibilities at any point. So we have to dismiss things at some level of improbability. So yeah, the person saying, well, I cried fire in the theater because I believe there were some hidden embers, that's not okay. And if people were stampeded and killed because of that, we would not say that's protected speech. So it might have been long-winded, but after thinking it through, I think it's actually all right that not all speech is protected. And I think that there's a point at where when a message is clearly not helpful, that it shouldn't be a matter of protected speech. And then the other thing too, we'll also hear about the idea of, personal choice. And someone will say, hey, look, you may think this about vaccinations, but I think that, and I have a right to my decisions. And that's also really compelling at face value. We have strong feelings around that. I sure do. People should be able to have their own beliefs and support that. But there's many cases in which our beliefs do not affect us in isolation. So I could say, I don't not drink, but I don't keep many alcohol industries in good financial state. I'll put it that way. I average about 6 alcoholic beverages per year, and there's no real plan or pattern to that. But yeah, so I don't not drink, but let's say that I had an alternate view on alcohol and driving. And let's say that I feel that because of my driving skills, I'm making this up, so I'm not beyond a normal driver, but let's say I were some greatly skilled race car driver, and I could argue that, because of my reaction time, my skills behind the wheel, that I could actually have a couple drinks and be safe, whereas someone else might not because of my unique situation. We don't allow that to fly because there's public harm. And even if I were right, it's hard to prove, but the risk of being wrong and the risk to public harm to others outweighs my freedom of choice in that capacity. And we've all really agreed upon that. In another example, we think about going to work sick. There are people to where they don't have options of missing work because of they can't so much call in, they need the hours, and that's tough. But in most cases, most work settings, people are frowned upon for showing up with snot pouring out and sneezing and coughing all over and fevering and sweating. That's not cool. And it isn't not cool because you're going to be miserable. You are, but it's not cool because you're going to get everyone else sick. And we know that, and it's not welcome. And you can't show up and say, yeah, but this is how I roll. I don't really believe that I'm going to make you sick. And I feel that I've got a better immune system and that if you were healthier, it shouldn't affect you anyway. So I'm just going to come in and cough all over you, and you got to deal with that. This is how I believe things. We don't accept that. We don't consider that valid. We don't consider that a case in where personal choice outweighs public good. And here's another bizarre example. Let's say we're talking about diabetes, and imagine diabetes were infectious. Imagine that if I had diabetes and I sat next to you in a cubicle, you had a 50% chance each year that you worked next to me of developing diabetes. Just making this stuff up. But imagine that were the case. Now, if that were the scenario and I was not diabetic, but I was on the edge of it, and I chose to have 24 donuts for my morning snack and my afternoon snack and my lunch every day, that wouldn't be okay to you because I would be clearly raising the risk of something that could make you sick. And we would say that's no longer a personal choice. It's a silly example, but seriously, if a disease like that were contagious, your personal choice would be butting up against the public good. And so I would argue that these things are not personal choices, unfortunately. These are communicable diseases, and we've got to consider how our actions affect that of others. And here's a little more about just how I live this and how this affected my life in direct ways and indirect ways. As a kid, we didn't have the chickenpox vaccine. I don't know if we would have had some version of the measles vaccine, but I don't think I received that. I had measles, I had scarlet fever, I had chickenpox. And the measles and scarlet fever, I could be wrong about the measles, but I'm pretty sure I had some scarlet fever or rubella. But the chickenpox was super memorable. I was epileptic. I had seizures from complications related to my cerebral palsy. And when I had chickenpox, I was down for like 3 weeks. And I don't think we had yet adopted my sister. I was probably less than 4 years old, but I remember it vividly. Just the pain, head to toe. Mom took me to the doctor. I had lesions inside my mouth. The doctor thought I had lesions down my esophagus. I was completely covered. I was just, in agony from the itching and the irritation, and there was no relief. And I remember having seizures left and right. The fever was driving me to have seizures. And I remember the only temporary, not even relief, but like partial relief, was Mom would take calamine lotion and cover me in that and then put me in a lukewarm tub for a little while. And it felt a little bit better. It wasn't gone, but it was a little bit milder. And I had this plastic toy boat, and it had a ramp. It had some cool little cars that would go up the ramp. And it was, I don't know, a little bathtub toy, but it was a treasured thing for me. We didn't have a lot of toys. And I saw it sitting on the edge of the bathtub. I was in the bathtub, and I went to reach for it, to pull it into the bathtub to play with it. And my hand passed right through it. It wasn't really there. I was hallucinating it. I was that sick. I was so feverish. I was going into seizures, and I was hallucinating. And I remember my hand passing right through the boat. And I remember just the sense of shock and fear, like, I'm really sick. There's something really bad happening. My mind is deceiving me. Things are not working right. And there was trauma and damage that happened to my brain from those episodes, from the fevers, from those seizures that were triggered by the fevers. And I hope to thwart premature brain aging. I have no guarantees that I will. I'll do all the right things, but genetically, I am predisposed to that. I've got an ApoE4 genotype. I do have a family history of both my paternal grandparents for having dementia and Alzheimer's disease. And I'll never know this, but honestly, the degree to which I'm apt to develop brain disease is influenced by those episodes I had as a child, and those febrile seizures and those deliriums, those hallucinations. Whatever my chances are of developing Alzheimer's are worse because of those episodes. And now they wouldn't have to happen could I have been vaccinated against those. That wouldn't have had to have happened to me. And I think too, we're concerned about vaccines being bad or dangerous or unnatural. And I'll pull apart the additives from the actual vaccinations for a moment. So the actual vaccination, they're really elements of an infection. And if you think about it, there have been so many iterations over the last couple hundred years of vaccines. And the earliest ones were just pretty much the infection themselves, but in a slightly controlled setting. But as they evolved, they were able to refine out the part of the infection that could grant you immunity and separate that from the part of the infection that made you sick, and make it to where you still got resistant, but you didn't get sick. But even the earliest attempts were better than being sick, and they were not perfect. There has been harm and side effect from vaccines all along, no questions. But that harm and that side effect is always fractional of the harm and side effect of the infection. And now we're at the point to where it's a ridiculously tiny fraction of the risk of the infection. The earlier ones were not great. They really sucked, but they were better than getting smallpox. They were lower risk than getting the actual disease itself. And over the last many, many decades, they've been refining and refining and refining and figuring out which part of the infection can grant your immune system immunity and which of the parts that make you feverish and have these inflammatory responses. That's not helpful. It's not useful. It is useful to develop immunity, and that's the only good part about being sick. But why not get the immunity and not be sick and not have all the trauma and all the risks? It's not unnatural. It's the same thing you're getting anyway, just not the bad parts of it. Our early food supply, we didn't have as clear of a sense about how there were certain contaminants in the food products. And we've gotten better at taking some of those out. Even animal foods, we can't eat them when they're putrefied. We need to have them when they're still in a state to where they're not overgrown or infectious. And we look at some things like many plant foods. There's tons of examples of plant foods that are inedible until they're processed in some way, until they're cooked, for example. And we've learned that, we've worked around that. So the vaccines, the active in part, the infectious part, they are natural substances. They work with our body's natural immune response, but they're done in a way to make it easier. Think about it almost like, it's like taking a self-defense class. Say that there's some odds of being mugged and we don't want it to happen. And say that there's certain physical maneuvers or moves that you could do that would help protect yourself against that and help ward off an attacker. Well, you could go to get mugged 100 times and maybe get good at it, but the risk of major harm would be large. So we take self-defense classes in controlled settings. Maybe there's an instructor who's not going to be malicious, and they may feign some of the moves of an attack, but they're not putting full strength behind it. And you're not really in danger, but in a controlled way, you're able to learn how to manage that danger. So if it did happen, you'd be safer against it. And that's really what the infectious portion of vaccines, that's what they really are. They're the feigned attack, enough to give your body some moves, some chops, some kung fu skills in the event of a real, actual attack. So that was like as a child, but then as a parent, and my daughter Celestina was born in 1998, and Wakefield's data was not discredited by that point. And there were concerns that I had about MMR and autism and vaccines in general. I was wary of them. It was just a big part of my culture. So we did not vaccinate her immediately after birth. In fact, we hesitated for several years. And luckily, there was enough people who had vaccinated for long enough prior to then to where things like measles were not becoming rampant again like they are today. And she was safe by luck of just lack of exposure in the environment, because times are different than they are even now. And we did ultimately find single-dose, preservative-free vaccines. We did spread them out. I've since learned that the current preservatives in vaccines are things that are really in the body already, in levels that are in the body already. And spreading them out, it seems like a reasonable precautionary principle, but the drawback is you're losing the window of protection. So the amount of time in which a baby is protected against the infection is taken away because of the spreading out. They're not protected in the times in which they should be protected. So that's the drawback against that. And in retrospect, if I knew then what I knew now, I would do things differently. And we say that a lot in life. If we're paying attention, we think about things we would go back on and do differently. So, yeah. And it's tricky. There's just so much emotion that gets wrapped up into this. And it's so easy to have fear be powerful. And you can always speculate fear, like the embers in the cushion. But at some point, you've got to say, how likely is that? And what is the evidence? In the discussion that I had with Dr. Cohen, he cited the evidence from the vaccine injury reporting networks. And again, those are networks that they don't filter. By and large, they're not saying, we don't believe you. They're taking all the reported issues at face value and just documenting them. And even with that data, the risks of the vaccines end up being a magnitude of order lower than the benefits of the vaccines. So taking all the probably spurious claims into account, there's lots of people in those claims who have things happen. I'm not exaggerating. They'll get vaccinated and be in a car accident the following day. That's probably not causation. That's maybe correlation, but that's not causation. But yeah, even leaving all those things in, there's a big difference. And then we also have a hard time making sense out of large numbers. When we're looking at things in probability terms, there's a principle by which it seems safer to not act than to act. And when in doubt, it seems more prudent to do nothing than to do something which even plausibly may be harmful. And, there's no way around that but to just lump it. There's many parts of our innate psychological reactions that we're used to overriding. I don't think I'm unique, but most of us have plenty of impulses throughout the day of, self-loathing, of anger, of upset. We have all these things that are there, but they're really so far below the threshold. And civilized people, we put a lid on that. And it's not a big deal to put a lid on that. So we've got to put a lid on other ways in which our brains form conclusions that are not consistent with the facts on the ground. And this is one of those, where there is a risk by acting, there is, but there's a much larger risk by not acting. So that's the big difference. And this is a tricky thing. Having this discussion, speaking with Dr. Cohen in my position, I believe that the possible benefit of having this, I'm not selling vaccines. I have nothing to gain by this. But I believe that in the world of natural medicine, we have so much to offer. And I think our real superpower is the strength of lifestyle. Diet, exercise, mind, body, hygiene. This stuff is huge. And for non-communicable diseases like diabetes, heart disease, fatty liver, these are the game changers. These drugs aren't the answer for these conditions, but lifestyle is. And I want natural medicine to have its real day in the sun. It deserves this. But I'm afraid that if we get wrapped up and we invest all of our capital and our I don't know, all of our goodwill into fighting things like vaccinations, we lose our credibility. We come off as pseudoscientific. And the problem is that then we try to take a stance on the power of lifestyle over statins. Well, those cranks don't know what they're talking about anyway. It's far too easy to dismiss. And my hope is that by being an insider and a real lover of the world of natural medicine, that I can be listened to differently than someone like a quackbuster. There are people that are just hateful and just vitriolic, and they have no knowledge about the positive sides of natural medicine or the real benefits that there are. They just out of hand react against anything that comes out of anyone's mouth who's a natural medicine person. And rightfully so, they're ignored. But unfortunately, we've got to raise the bar. And all industries, all groups of people need some way of saying, hey, how can we take what we know now and step it up? We've got to evolve. We've got to grow. And I'm afraid that that's been lacking in my industry for some time. We have no real mechanisms of internal policing is a strong word, but internal growth, internal guidance. So I'm hoping to create a bit of a voice that way. I don't want to come off as a crank, as an outsider, as a misanthrope. Again, I love natural medicine. This is what changed my life. This is my career, my livelihood, my profession. I didn't go to medical school and then take some training in natural medicine afterward. I went to a naturopathic medical school from the get-go. I knew this was my direction. So please hear this as criticism from a loving sibling and not criticism from an angry enemy. This is like, how can we step up our game? How can we do better for our people? So just glancing at my notes, did I miss any points? I guess just one last thing, back to the idea of the concerns of adjuvants or toxicants within the vaccines. There's a concept of no observed effect limit. Things that are bad to a point, and below a point, they're no longer bad. To pull up alcohol again, I don't drink a lot, but if I drank a lot, I couldn't walk very far in a straight line, right? Let's say that totally sober, I could walk 100 feet on a perfectly straight line, making it up. Say if I had 6 beers, I could walk 10 feet on that straight line. Now, there's a point at where if I took a teaspoon of beer and put that in a giant punch bowl, and took a teaspoon of that punch bowl, put that in another giant punch bowl, and then drank a glass of that, there was some alcohol in there. But if you measure me on the straight line, it would be no different than if I had consumed no alcohol. I could still walk 100 feet. So all things that are thought to be bad are bad at a point and at a dosage. And not only that, but we've learned that there are hormetic effects, meaning that tiny amounts of bad things are actually good things. That's bizarre, but broccoli, there's some vitamins, there's some fibers, there's some minerals. Those are things that are just straight across good. But a lot of ways in which broccoli is good is because it's a little bit poisonous. It's got a lot of glucosinolates, which are insecticides. And if you could get a big dose of glucosinolates, it would wipe you out more than glyphosate could any day, dose per dose. No kidding. It's by far more dangerous than conventional pesticides. But the microscopic amounts that happen to show up in broccoli end up triggering our body's own defensive mechanisms. Our liver gets a taste of glucosinolate and it says, ooh, that's nasty. I better beef up my production of glutathione and superoxide dismutase and NRF2 pathways. I've got to get ready for the onslaught. And the net effect is we're healthier for that. So not only are bad things not bad in any amount, but there are situations in which bad things in tiny amounts are actually good. So the adjuvants, the quantities used, as I talked about with Dr. Cohen, are minuscule. And by and large, when we're talking about formaldehyde and aluminum, those two remaining ones, they are already in the human body in amounts that are higher than they are in vaccines. So bizarre stuff. But again, with love, with a brother, with fan and compassion towards natural medicine, and love towards all the good things of lifestyle and the efforts towards that. Dr. C here. I'll be back with you with more medical myths, legends, and fairy tales. In the meantime, take great care of yourself. Bye-bye. Hey, Dr. Christensen here. Thanks so much for joining me for another episode. Is there a topic you'd like me to cover? I'd love to hear from you. Just go to Dr. Alan Christensen on Facebook or Instagram, write your question, and use the hashtag #MedicalMyths. Did you find this show helpful? If so, please take a minute and leave us a rating on iTunes so that others can know. Thanks much, and I'll be back with you real soon. Bye-bye.